and thank you for joining me. My name is Jane Kotzer and I bring to you, in layman terms, psychiatric injury awareness. Please note that my dedication is to psychiatry and not psychology. Psychologists help their patients through psychotherapy, which is talking. Psychiatrists medicate their patients and is my topic of focus. All the content that I share on the topic of psychiatry is for information purposes only and does not constitute as medical advice. Please consult with a knowledgeable prescriber before attempting to reduce or stop any psychotropic medication. Without further ado, let's get going on today's topic, which is how to be an empowered patient by understanding the PPI, the patient package insert. If you have one of these lying around at home, now would be a good time to pause this video, go and fetch it, and let's work through it together. You would normally receive a PPI when you get a new box or container of medication. The patient package insert will be included. If not, pharmacists are very obliging and helpful and they will give this information to you. Or else you can log on to SAPRA. I'll put the link here, search the name of your medication and you'll be able to download the PPI in PDF format, much easier to read. If you can't find it there, you can also look on the FDA's website. It is of utmost importance for your health that you read through these pamphlets. I was recently watching this lawyer. She was speaking about a time where she represented her client who was a patient of the doctor on trial, and the doctor did not disclose the adverse reactions that the patient suffered. And upon questioning, the doctor turned around in court and said, well, the patient had the PPI, it was up to them to read it. If they didn't read it, it's not my problem. So I just wanted to highlight how important it is to read through these PPIs. Also, it's not only the bad things like side effects and black box warnings that are on these pamphlets, but also what foods to avoid. If you've got food sensitivities, what time of day to take the medication, all of that is in these PPIs. I do totally understand how very overwhelming these pamphlets can be. That's why I'm here to help you turn this mountain into a molehill. So I'm just going to run through it and then I'll just spend some more time on the very important key points that you should really spend time on and just make sure you understand. It's also a very good idea to go and speak with your pharmacist. They are less likely to have a biased opinion of the medication, and they will definitely be able to assist you with contraindications, side effects and things like that. But let's get going. First up, we've got the name of the medication. Then we go on to the scheduling status. The higher the status, the scheduling status, the higher the risk of the medication is. So the schedules are based on some factors in order to classify the different schedules. It's based on toxicity levels, the illness it's treating, the safety levels, the need for diagnosis, and the potential for dependency or abuse. Then we've got the dosage forms. So this pamphlet will explain to you what different dosages or different tablet dosages this medication comes in. So for instance, like Seroquel, you get the 25 milligrams, the 50 milligrams, or no, you don't get 50. You get 25, 100, 200. So that's what this indicates. And it will also tell you if it's in tablet, capsule, or liquid. Next up is the composition. This indicates the ingredients of each tablet. Please just check this section out if you have food sensitivities and allergies. It is often indicated in this section. Also, the list of inactive ingredients are listed in this section, being artificial colorants, flavorings, and fillers. Next up is your pharmacological classification. This is where it will tell you what type of medication it is. So whether it's an antidepressant or a hypnotic is used for sleep, so don't worry when you hear that word, or an antipsychotic, that sort of thing. It's under the pharmacological classification. Next up, we have the pharmacological action. This basically explains to you how the medication is absorbed into your body, how it's distributed in the site of action, and then excreted or removed from your body. So it will detail things like rates in accordance to your metabolism, that sort of thing. It's a little bit tricky, not extremely important thing to know, but interesting to read. Next up is the non-clinical toxicology. So this means that this means there could be conditions or diseases that could not be determined in the clinical trials. For instance, where medication is tested on an animal, they cannot determine if fertility problems or cancers can be derived from the medication. Next up is the indications and usage. This is very important to note. This is where it will tell you how long you're supposed to be on this medication. For instance, for benzodiazepines, this is where it will tell you you should only be on the medication for a very short period of time, like 4 weeks. So it's very important to take note of this specific section. And then also in this section, it explains what the medication was approved to treat. But remember, there are also off-label reasons why doctors prescribe medication, which is legal, so don't worry, totally fine to do, but just make note of the dosage and indications. Next up is the contraindications. This is very, very important because this indicates where the medication should not be used. So if you're pregnant, you need to read this section. If you've got sleep apnea, heart problems, liver problems, whatever the case is, it will be indicated in the contraindications. The next very important section to take note of is the warnings and special precautions. This is the same as black box warnings or boxed warnings. I have spoken about it on both my Facebook and Instagram accounts. If you just go and have a look through, there are little blocks, there are little pictures saying black box warnings, and I've written something underneath, or just Google black box warnings and see how dangerous and important it is to know. Black box warnings are not like side effects. Black box warnings are very, very serious effects that the medication can have on you, which include coma and death. Next up is the dosage and administration. This section tells you what the maximum dose is per day for that medication, and it will also tell you if you should take it before or with food or after food. There could also be a separate section under this section that explains to you how to give this medication to children or to older people and those with specific medical conditions. If your doctor has prescribed a very different regime to what you see in this section, it is very important for you to contact your doctor or go and see your pharmacist. Then we've got the side effects. Within side effects, there are 6 subcategories. We've got very common, common, uncommon, rare, very rare, and then unknown or frequency unknown. Then that relates to all your bodily systems for those known side effects. I don't know if this is making sense. For instance, the bodily system is gastrointestinal disorders as a side effect from the medication, and then it will tell you if it's rare, very rare, common, very common, unknown, whatever. I've noticed in some of the newer SSRIs or antidepressant medication in the pamphlet, this is all tabled, so it's not written out. The table format is far easier to understand. Also under the side effects section, specifically in psychotropic medication, you'll often be told what the discontinuation side effects are, which is your withdrawal symptoms. Then we've got drug interactions. This is one of the most important parts of this leaflet if you are taking other medication. The reason being is, for instance, Lexamol is an antidepressant. If you are taking Lexamol and you're also suffering from migraines and you're taking any, specific migraine medication, there are serious drug interactions. if you're taking both those medications at the same time. So that this section is very important to read. If you are on oral contraceptives, this section is very important to read. Please also note that over-the-counter medicines also have drug interactions with prescribed medication. Next up is pregnancy and lactation. Very important if you plan on being pregnant, becoming pregnant, or if you are pregnant. Please always read this section in your PPI. Something important to note, Simgen is an antidepressant, an SSRI. The side effects of Simgen in pregnant women is unknown. Next up is the known symptoms of overdose. This explains what happens when somebody overdoses on this specific medication. If you suspect that your loved one or someone you know has overdosed on the medication, please don't resort to Facebook or WhatsApp group for advice. Please immediately get them to the hospital. Next up is description and indication. This category explains to you exactly what the tablet looks like. It will tell you the texture, the color, the shape, if it's a tablet or a capsule. If the medication is a liquid, this is where it will tell you if it needs to be shaken before use. We're almost at the end, so hold on. Next up is a presentation. This will tell you if the medication comes in a blister pack or whatever the case is. Then you've got your storage instructions, which is very important. And one thing to note under this section is if you do go and get your medication and you decide to pop it in the car and go back into the shop and spend 4 hours in the shop while your medication is sitting in the hot car, in the cubbyhole or in the boot, not really a good idea. Rather get your medication when you know you are going straight home. Medication is sensitive to temperature and you don't want it to not be effective as it can be, and that is why the storage instructions are included. Then the last 3 sections relate to the registration of the medication. This includes the registration numbers, then the name and address of the registration of the holder of the certificate, and the date of the publication of the PPI. And that is it. If there's only one aspect that I hope you learned from today's video, it will be that you do not blindly accept medication from your doctor without knowing exactly what could happen to you if you take the medication. I hope you now have a better understanding of what is in the PPI and how to read and digest the information. I also hope that you know now what are the most important key points of the PPI. Other than that, I hope you have a wonderful day further, and remember, being an empowered patient starts with you. Stand up for yourself, you are worth it. Stay safe, God bless, and see you next time.